Back when I was 16 in 1982, I had a traumatic injury to my knee. Got hit by a football helmet that the person dove into my lateral side and shredded my three main ligaments, as well as significant trauma to my lateral meniscus. Ended up having significant surgery, all three ligaments replaced, as well as 50% of my lateral meniscus taken out at that time. 1989, had another injury to my left knee where I re-damaged it playing volleyball and had 40% of that lateral meniscus taken out. So I was left with 10% of my lateral meniscus basically from age 23 through life. And then when I got into my upper 30s, my knee really started to break down. Clearly, not having that lateral meniscus in there just caused the breakdown of the articular cartilage in the knee to start to have a lot of surface issues and getting to the point where, say from age 40 until 44, when I ended up at the Stone Clinic, just significant 24/7 pain for about 4 years. Went to a whole host of different doctors over that time, trying to find options other than a total knee replacement. All doctors up in the Northeast, in the Boston area. And after 4 years, nobody would do anything other than that. No one would try to be progressive and try to fix the articular cartilage or do a lateral meniscus transplant. The other thing I found out is along the way, my ACL must have snapped, so I had no ACL as well, which also contributed to the articular cartilage breaking down because I had no stability in the joint. In the meantime, during those 4 years, doing my research online, I came across the Stone Clinic, but didn't really want to come out here yet because I wasn't sure if anyone would step to the plate in the Massachusetts area. So I sort of deferred. And then finally, when no one would step to the plate in Massachusetts, I gave the Stone Clinic a call. Had a great phone consultation with Dr. Stone, sent them all my information ahead of time. And I came out here for a visit in July of 2010. After a good consultation with Dr. Stone live, I decided to go the path of having my joint restored biologically. We decided a split approach was the best approach, where 2 surgeries, one in early August and one in mid-September. A couple pace grafts, a host of cleanup, and that was the first surgery. So I was non-weight bearing after that surgery for 5 weeks. During that first 5-week period, 3 times a week I came to PT, and then in mid-September we had the second surgery, which was a lateral meniscus allograft transplant as well as an ACL transplant. So had that surgery done, again non-weight bearing at the beginning, PT 3 times a week. In total, I was at the Stone Clinic for roughly 3 months. I stayed at an apartment complex next door, which was great and convenient. Allowed me and enabled me to be able to do PT here with the great PT team at the Stone Clinic, which when you're going through a surgery like this, and it is a complicated surgery, you want to have the best PT team servicing you to try to get you up and running as quickly as possible. This is my 5-year outcome evaluation, and everything looks great. I'm able to do a lot of things that I was doing, prior to me getting into my, late 30s when my knee started to break down. I'm able to do all the basic, general things in life that you take for granted, like going to work, sleeping, getting up, watching TV without pain. And those are the type of things that I stopped being able to do when I was in my early 40s. Those simple things just were very painful. But now I'm able to golf. Now I'm able to exercise. I'm able to bike. I'm able to do an elliptical. I'm able to go for a long walks with my wife, and those are things that I lost the ability to do. I'm able to go up and down stairs, and you take that for granted. And when you're in your early 40s and you lose that ability, it's pretty cool to be able to do it again without pain. And it was a little investment of time and money in myself and in my future self to make sure I was giving myself the best opportunity to be successful later in life and not be hobbled around by having 1, 2, 3 revisions of a total knee replacement. And when you get to that stage, you end up with a lot of complications. And now, 5 years out after having my split surgery approach with Dr. Stone, ironically, I'm not even a candidate for a total knee replacement at this stage. I live without pain, and I have a joint that's functioning, well enough to do all life basic functions as well as, things that I couldn't do back then. And if I'm not a candidate at this point for a total knee replacement, my gut is that I have many, many years to go before I would be. And I think that's an important point where you buy a lot of time by taking this kind of approach, as long as all the stars aligned and it's a successful surgery and you take all the right precautions personally to do the right thing from a physical therapy standpoint.